This is my head-to-toe assessment submission for Sharon Kudrow's class. I have already gathered all of my supplies needed for the assessment. I have also already performed hand hygiene and provided privacy to the patient. Now I will introduce myself to the patient. Hi, my name is Adrienne and I will be your student nurse today. I will need to perform a head-to-toe assessment. This assessment is to gather information regarding your current health status and any health concerns that may be present. I will need to ask some detailed questions. Would that be okay?
Yes.
Do you have any physical limitations to prevent you from moving positions like sitting, standing, or repositioning yourself?
No.
Perfect. Now I will assess the patient's mental health status. Okay, can you tell me your name and your date of birth, please?
Caitlin Ehlert, 7/13/96.
And do you know where you are?
Estrada's house.
Okay, and what year is it?
2021.
And why are we here?
Head to toe assessment.
Perfect. Patient is alert and oriented ×4. Answered questions with good response, and facial expression is within normal limits. Now I will assess the skin. When you're assessing the skin, you're assessing for skin color, any lesions, any color, lesions, or abnormalities. A patient's skin is within normal limits for their ethnicity. And now I will assess for skin temperature with the back of my hand. And this temperature is warm to the touch, which is normal. Now I will also check for skin turgor. The best place to do this is in the clavicle, but you can also do it in the back of the hand and the forehead. Turgor is immediate, which is normal. Now we'll assess the nails. You're assessing for shape and color. Shape is good. Color is within normal limits. There are no abnormalities, no lesions, and no clubbing present. I will also assess the capillary refill. You do this by pressing onto the fingernail. Capillary refill is less than 3 seconds, which is normal. Now I will assess the head and the neck area. So when you're assessing for the head, you're assessing for shape, symmetry. Patient's head is symmetrical and normocephalic. Now I will palpate the scalp, and that is smooth, symmetrical, and normal. Now we'll assess the first cranial nerve, which is cranial nerve number 7, and that is the facial nerve. And can you smile for me? Can you frown? Can you show your teeth, puff out your cheeks, raise your eyebrows, and close your eyes tightly? Patients did that with ease. Cranial nerve number 7 is intact. I take a breath for just a second. Okay, now we'll assess cranial nerve number 5, which is trigeminal. Can you clench your jaw? Can I assess for tenderness in the masseter and up to the temporal? Now I'll also assess for their dull and sharp pain. I'm going to grab my tool. Can you please close your eyes for me and tell me if when you feel it, if it's dull or sharp?
Dull. Dull. Sharp.
Perfect. Cranial nerve number 5 is intact. Now I'm going to inspect the neck. Neck is symmetrical, no protrusions, no abnormalities, no tenderness is present, no swelling or redness. Now I'll palpate the lymph nodes. Okay, and that is going to be the occipital, postauricular, preauricular, tonsillar, submandibular, submental, deep cervical, and posterior cervical. And then you also assess the supraclavicular lymph node. And while you're doing this, you can also assess for cranial nerve number 11 by having the patient shrug their shoulders. Can you shrug your shoulders, please? Perfect. Cranial nerve number 11 is intact. Now I will assess the trachea by palpating it. Trachea is midline. Now I will check for jugular vein distension. I'm going to go ahead and grab my tool for this and have the patient go lay down. When you're checking for jugular vein distension, you want to make sure the patient is at least a 30 to 45 degree angle. You'll have them look to the side and you shine your pen light, just checking for any pulsations. Okay, that is good. Jugular vein does not seem distended. Can you go please sit back down for me? Okay, now we'll assess the eyes, and when you're doing this, you assess for cranial nerve number 2. That tests for visual acuity, which I had done that with the Snellen chart, and the patient's vision was 20/20, so cranial nerve number 2 is intact. Okay, now we'll observe the eyes for position and alignment. I'm going to also go ahead and grab my tool for this, so I will use it here in a little bit. So eye positions are within normal limits, no protrusion, no sinking is present. Now we'll palpate the lacrimal apparatus, no tenderness, no drainage or swelling. Now I'm going to observe the sclera and the conjunctiva. Can you look up for me? Okay, sclera of the eyes is white, conjunctiva is clear, moist, and smooth. Now I'm going to check for direct pupillary response to direct light. Okay, pupil constricts normally. Now I will assess for indirect light. Pupils constrict normally. Now I will assess for accommodation and conversions by having the patient look out at a far object and focusing on my pen light. Can you look out to this object for me, please? Okay, perfect. And then can you look at it now? Now we'll assess cranial nerves number 3, 4, and 6 using the 6 fields of gaze. Can you follow my pen light? By doing this, she followed it easily. Cranial nerves number 3, 4, and 6 are intact. Okay. Now I'm going to be assessing the ears. When you're assessing the ears, you're checking for symmetry, color, any abnormalities. Patient's ears are symmetric, no abnormalities, no redness or discoloration. Now we'll inspect the auricle by pulling down. Auricle responds quickly with no redness or swelling. Now I'll inspect the tragus by pushing in. No tenderness is present. Now we'll inspect the lobes of the ears. Lobes are even, no redness or swelling present. Now we'll inspect the auditory canal. I'm going to go ahead and grab my otoscope for this. And when you're inspecting the auditory canal, you're looking for a pearly gray color. Okay, pearly gray is present and no discharge present either. Okay, now we will be assessing for cranial nerve number 8, and this you do by doing the whisper test, Weber test, and Rhine test. So when you're doing the whisper test, you want to have the patient cover up one ear and whisper a word and have them repeat it back.
Banana.
Can you do your other ear for me?
Apple.
Perfect. Now I will need to grab my tuning fork to do the Weber test. And so when you do the Weber test, you want to have the patient, you want to strike this, and then you want to hold it on top of the head and ask the patient if they hear it in either one side or both sides. Okay, tell me if you hear it in both or one side.
Both.
Perfect. And then for the Rhine test, you're going to be checking for bone conduction and air conduction. So when I push this on your mastoid process, let me know when you can no longer hear it. Okay, and then now let me know when you can no longer hear it. Okay, Rhine test is negative because air conduction was 2 times longer than bone conduction. So cranial nerve number 8 is intact. Okay. Now we're going to check for the nose and the sinuses. So you want to inspect the nose for color and symmetry. I'm also going to go ahead and grab my pen light for this. Excuse me. Okay, color is even, smooth, no protrusions, no redness or swelling present. Now I'm going to check the sinuses by pushing in on the near the nose and above the eyebrows. No tenderness or swelling present. Now we'll inspect the patency by having the patient look up. Perfect. Patency is normal, no discharge present. I'll go ahead and put my pen light down for just a second. Now we'll assess the cranial nerve number 1, which is the olfactory. Now when you do this, you want to have the patient close their eyes and smell an item and identify that item. Can you please close your nose for me? Or close your eyes, I'm sorry. Okay, and what do you smell?
Coffee.
Perfect. Cranial nerve number 1 is intact. Okay. So now we are going to inspect the mouth and the throat. And you're going to inspect the lips, and you're checking for color. Color is normal to the ethnicity, smooth, no crack or dry. Now can you show me your teeth? Perfect. Colors within normal limits, no decay. And can you show me your gums? I need to get my pen light for this as well. Perfect. Gums are normal, no discoloration or redness or swelling present. Okay, now we'll check the tongue. Going to check for cranial nerve number 10, and then you have the patient press against the tongue depressor to assess for strength of the tongue. Perfect. Perfect. Cranial nerve number 10 is intact. Now I will assess cranial nerve number 12. Okay, and can you... I apologize. Let me go back and redo that. Okay, so cranial nerve number 10 is actually by having the patient have them open their mouth and say, oh, vagus is midline. Now I am assessing for cranial nerve number 12. And that's when you have the patient press their tongue against the tongue depressor to test for strength. Okay, perfect. Perfect. Now I'm going to also assess for cranial nerve number 9 and then have the patient swallow and you feel for any abnormalities. Perfect. Cranial nerves number 9, 10, and 12 are intact. Now I'm going to be assessing the arms, hands, and the fingers. Okay, and that's when I will check the radial pulses. You check them bilaterally. Pulses are normal and 2+. Perfect. Now I'm going to be checking the reflexes of the patient. So when you're testing for the reflexes, you want to do the brachial, this is the tricep. Perfect. And then you turn it over and you do brachial. And then this is the radial. Perfect. Now we'll be assessing the back for palpating for posterior firmidus. So when you're doing that, you want to auscultate and have the patient say 99. Okay, say 99.
99, 99, 99.
Breath sounds are normal, even, and clear. So now I'm going to percuss the posterior chest for sounds. Resonance is heard with that. Okay, now go ahead and turn back towards the front for me. Or if you can, maybe turn again so the camera can see. So also on the posterior, you want to auscultate for sounds, which I did not do, so I'm going to go back and do that. Okay, take a deep breath. Take a deep breath. And the positions I did were the top left, top right, midline on the right, midline on the left, and lateral on both sides. Now I'm also going to go back and check for chest expansion in the posterior. You do this by putting both hands on each side and have the patient breathe deep. Okay, chest expansion is symmetrical. Okay. Now I'm going to be doing the anterior chest, inspecting for respirations, respiration patterns normal. The patient doesn't have any labored breathing, no trouble breathing. Now I'll also check for chest expansion. So I'm also going to do that by putting my hands on both sides and having the patient breathe deep. Chest expansion is symmetrical. And I'm going to go ahead and I'll palpate for anterior firmness and have the patient say 99.
99. 99. 99. 99.
Okay, perfect. And then I'm going to go ahead and auscultate for breath sounds in the front. Go ahead and breathe deep. No swishing or blowing and sounds detected. Now I'm going to go ahead and auscultate the heart sounds. And when doing this, you can either you want to do the diaphragm and the bell. For this assessment, I'm going to go ahead and use the bell. Turn towards the front for me. When you do this, you assess for the aortic, which is in the second intercostal space, pulmonic in the second intercostal space on the left sternal border, Erb's point, tricuspid, and mitral. And when you're also there, you want to go ahead and palpate the apical pulse at the mitral valve for 1 full minute. Okay, now I'm going to have the patient go lay down on the couch and assess the abdomen. I don't think I need anything over here. Maybe the reflex hammer. Go ahead and lay it all the way down for me. Okay. Okay, when you're inspecting the abdomen, you're looking for any protrusions, distension, discoloration, any abnormalities. The patient's abdomen is within normal limits of color. It is also midline and no abnormalities present. Okay. Now I'm going to auscultate the umbilicus, and I did that, and you do that with the pen light, which is over there on the table. Okay. No color is normal. Okay, now I'm going to auscultate the 4 quadrants of the abdomen. And when you do this, you start with the right lower quadrant, then you go to the right upper quadrant, left upper quadrant, and left lower quadrant. All sounds are normal. And now you want to palpate those sounds. Now you want to palpate as well. So go ahead and palpate left, right lower, right upper, left upper, left lower. No tenderness or abnormalities present. Now I'm going to go ahead and check for the vascular sounds in the abdomen. And you do this with the bell of the stethoscope. Okay, so when you do that, you want to do the aortic, you want to do the renal, the iliac, and the femoral. No bruits present. Okay, perfect. Okay, so now we're going to go ahead and percuss over the abdomen. I'm going to go ahead and put my thing back on. Okay, we're going to do the left, right lower, right upper, left lower. Okay, and now I will assess the legs. So go ahead and have the patient pull up. Okay, and when you're assessing for the legs, you're just looking for, again, any discoloration, any abnormalities, any swelling, edema, or lesions. Patient's legs are normal in color, no abnormalities, no lesions, no edema is present. Now you want to palpate the radial pulses bilaterally. Pulses are symmetrical, and 2+, which is normal. And then you want to go ahead and palpate the anterior tibialis. You want to do that bilaterally as well. Pulses are even and 2+. Okay, now you want to do the toes. Toes are normal in color, no discoloration, no redness, and you also check for capillary refill. Capillary refill is less than 3 seconds. Now we're going to check for the reflexes. Okay, and before we check for the reflexes, I'm going to have the patient lay back down so I can check for sacral edema. Can you turn to your left and lateral for me? No sacral edema is present. Okay, now I'm going to assess the lower extremities for reflexes. Okay. Perfect. And then you do the Achilles. Perfect. Okay. And now we're going to assess the patient for balance. Can you stand up for me? Okay. And then can you walk with heel to toe? Perfect. Now we're going to do the Romberg test. And with the Romberg test, you just have the patient hold their hands out and close their eyes. Make sure they are balanced. Patient is well balanced and no swaying present. And now we are done. In my previous head-to-toe assessment, I missed a few things, so I will now go back and reassess what I missed. Alex, is that okay with you? Okay, cool. Okay, so when I inspected the mouth in my previous video, I missed inspecting the hard and soft palate, so I will now do that. So when you do that, you want to have the patient open their mouth and then inspect the hard and soft palate with your pen light. What you're looking for is the hard palate to be white and the soft palate to be pink. Can you please open your mouth for me? Hard palate is white, no lesions, no discoloration, no abnormalities. Flip your tongue. Soft palate is pink, also no lesions, no abnormalities, no discoloration. So that is normal. And I also, when I was inspecting the neck, I forgot to auscultate and palpate the carotid and thyroid. So now I will do that. So when you palpate the thyroid, you can do it from the front or the back. For this assessment, I will do it from the back. And you will have the patient tilt their head down and to the right. And then you will just feel for any abnormalities, any masses, anything out of the ordinary. And so if you cannot feel the thyroid, that is normal. No thyroid detected, so that is good. And so now we'll go ahead and palpate the carotid. And when you palpate the carotid, you don't want to do it simultaneously. You want to do one side at a time. Otherwise, the patient will pass out. Okay. Now we'll palpate the carotid. It's normal, no masses and no abnormalities on either side, so that is good. Now we'll go ahead and auscultate the carotid and the thyroid. You can do that from the front. You don't have to go to the back for that. And you want to do that with the bell of your stethoscope. You'd be auscultating the carotid and the thyroid, and then the carotid and the thyroid. Sounds are normal, no bruise detected. Now, when I will have Alex go ahead and lay down, when I assess the abdomen, I actually, let me move this out of the way. When I was assessing the abdomen in my previous assessment video, I did these steps out of order. So what I did in my previous video was I inspected, auscultated, palpated, and then percussed, but it should have been inspect, auscultate, percuss, and then palpate. Also in my previous assessment video with the abdomen, I forgot to inspect the diaphragm for friction rub in the spleen and in the liver. So when you do that, you want to do that with the diaphragm of your stethoscope. And when you're auscultating the spleen for friction rub, you want to do that on the left side of the patient underneath their breast right here. No abnormal adventition sound detected. And then for the liver, you want to do it on the right side, right below the breast as well. No abnormal or adventitious sounds detected. Okay, so now I will go on to the legs, feet, and toes. And what I missed in that is in my assessment, when I was palpating the pulses, I said the radial pulse, which that should have been dorsalis pedis. So when you assess the pulses on the feet, you want to do the dorsalis pedis bilateral. Pulses are even, normal, and 2+. Also in my previous video, when assessing the posterior tibial pulse, I said anterior, so that should have been posterior. So when palpating the posterior tibial, you do it bilateral, pulses are even and normal, 2+. And then also when I was doing that section, I didn't inspect resistance. So when you do that, when you have the patient flex their feet against, and then pull up, and then push, patient does that with ease, and that is normal. And then also I need to have her do the heel to shin test, where this is testing for cerebellar function. Go ahead and lay that down. And you want to take your foot and go from your knee to down your leg. Patient does it with ease, and go your other side. And patient does that with ease, so the function is normal. Thank you, Ms. Cudjoe.